questions, then you can ask this guy here, because that's what he does. He's a plastic surgeon and he answers questions. So if indeed there is someone with a plastic surgery question out there, they are absolutely in the right place. But I'm not going to wait, okay? Because I know that I've got a very wide reach, and I know there's a lot of people out there, and I'm sure questions will start flooding in. But it's okay. Relax, sit back. You don't have to jump in, because I've got some preordained questions, thank goodness. So I'm going to start with this one right here. And this question says, how often do you preform thigh lifts? Now, you and I both know that should be perform thigh lifts, so we're going to just gloss over that. How often do I perform thigh lifts? Hardly ever. I hardly ever do thigh lifts. And there are a couple of reasons for that. One is that thigh lifts aren't that common. Are not that common an operation. When you're looking at body contouring surgery, which is usually following either weight loss or pregnancy, or putting on losing weight, stretches the skin, and you're left with redundant skin once you've lost weight. And the sort of body contouring operations, things like facelifts, breast lifts, arm lifts, thigh lifts, tummy tucks, out of those, the arm lifts and the thigh lifts are much less common than the facelifts and the breast lifts and the tummy tucks, because the scars of those operations can be hidden, and the scars of arm lifts and thigh lifts cannot be hidden, and so it is difficult to kind of reconcile that, because you're often doing it for cosmetic reasons, that you don't like people seeing your thighs, and then we give you a big scar, and you might then not want people to see your thighs because you've got a big scar. So you're trading one cosmetic thing for another cosmetic thing. So that's the first reason why I don't do many, because it's trading one cosmetic thing for another thing. I have that conversation with everybody before having a thigh lift. Therefore, a lot of patients don't go ahead and have surgery, which is fine, because I'd rather that than I do the surgery and then they're unhappy with the scar. And the other reason is because of the way that I do thigh lifts is with a big visible scar, because there is a way to do a thigh lift without a big visible scar. There is a way to do a thigh lift where you hide the scar in the groin. And there's a lot to be said for it, because as I just said, you've got one cosmetic problem, and the way I do it, I put a big scar down the medial aspect of the thigh, down to just above the knee, and that's obvious in short skirts and shorts and things like that. So having the scar hidden, you would imagine, would be very appealing, and so that a lot of patients would prefer the way where you hide it in the groin. However, I don't do that type of thigh lift, and the reason I don't do that type of thigh lift is because I don't find it does a very good lift. I don't find it gives a very good result, and the reason is I know that is because I've done it in the past, and it's not given a great result, and it's quite an expensive operation, and it's not great when you're trying to convince a patient they've got a good result when they're still saying, oh, we've still got skin laxity and what have you, because a thigh lift, when you are using the scar that's hidden in the groin, kind of pulls the skin up in an upward direction. It tightens the skin in an upward direction, whereas the excess is usually in a circumferential direction. So that's why the one that I do is much more effective at tightening the skin, because it takes that sort of cylinder of skin. It takes a big wedge out of that cylinder of skin and really tightens the skin around the thigh, which is much more difficult to do if you're trying to sort of tighten the cylinder by taking it in an up direction. So the one that I do gives a much better thigh lift, but it gives a much more obvious scar, and so some people don't want that obvious scar, and I can understand why they want the one which is hidden in the groin, but I don't do it mainly because it doesn't give a very good result in my hands. I think people do it, and maybe they've mastered the technique. So I always say, look for someone who does it and gets good results, because that would probably be someone who would be better to do that than myself because I find that it doesn't give a great lift. The other problem with it is it's a difficult scar for healing. You can get delayed healing. It's a hot and sweaty area in the groin. You can get pull. It can pull at the sort of female anatomy a bit and cause issues down there, and it can cause stretch scarring, and so there's other issues, but they're not the main reason that I don't do it. The main reason, because I could kind of live with those if it gave a good lift and a hidden scar, but it just doesn't give a good lift in my hands. So I don't do that sort of scar where it's hidden in the groin. I do it with a big scar down the medial aspect of the thigh, which means that I don't do many. I don't know if that means why I don't do many. Maybe it's just because, well, I don't know. I don't know why I don't do many, but that's why I don't do many. I just find it's not a common operation. We don't get many people asking about it. Maybe there's someone out there who kind of specializes in it and does loads, but not many people specialize in that sort of thing. Breast, body, face. There's quite a lot of surgeons specializing in those things because they're quite common, but the thigh is not that common. So that's where I am on thigh lifts. In case you were wondering, well, someone was obviously wondering, so asked the question. But if anyone else was wondering, that's my stance on thigh lifts. That's my thigh lift stance. So, how would you? Next question, please. How would you determine if I have a cyst or an osteoma? Okay, so this is usually, I mean, you can get osteomas anywhere on the knee and all. So, an osteoma is a bony lump. So the common place we see them is on the forehead. So lumps on the forehead. So first of all, a cyst is much more common than an osteoma. So if you've got a lump on your forehead, it's more likely to be a cyst or maybe a lipoma. So cysts and lipomas are more common than osteomas. So it's something we really need to see you and examine to see whether it is an osteoma. But in general terms, a cyst will kind of move. You'll be able to move it. And a lipoma will be movable like that, slightly different. A cyst is kind of in the skin, so you can move around the skin. A lipoma is kind of underneath the skin, so you can move underneath the skin. If it kind of does not move at all, and if it's bony hard, you try and move it and it's just completely static, it's basically stuck to your skull, then it's an osteoma. And we can remove it, but it's just a bit more difficult to remove it because you need the instruments, and we've got to often go to the hospital for the instruments and stuff, but we can definitely remove it, and but it adds a slight level of complexity to things if it's an osteoma rather than a cyst. Sorry, white on white, I should have black letters on there because I can't see it. So yeah, so it's just basically if it doesn't move, then the concern is it's an osteoma, and that makes it a bit more difficult to remove. So well, I won't say probably, we wouldn't be able to do that as a see and treat. If it's an osteoma, we would have to arrange to remove that at a different time and get the equipment and stuff. But if it's a cyst, yeah, we can do that as a see and treat, no problem. Different kettle of fish. What is the recovery process following inverted nipple correction? So local anesthetic, so in and out the same day. Waterproof dressing, so you can wash and shower straight away. Dressing comes off in a week. And because you have a waterproof dressing on for a week, we normally tell people to kind of take it a bit easy. You don't want to get too hot and sweaty because the dressing doesn't really breathe. So you want to take it a little bit easy for that week. Nothing, you can go to work and stuff, but just not gym and running and all that sort of stuff. After the week, the dressing comes off and it can breathe a bit. You normally don't need a dressing after a week. Sometimes you get little bits that are a bit bruised and a bit scabby, and you can get little bits and bobs, but usually you just need a bit of gauze in your bra after the first week, and stitches are dissolvable, so you don't have to have stitches removed. And yeah, it takes a while for it to it looks a bit funny to start with, and takes a while, a few weeks to settle. But in terms of recovery, your nipple will look a bit funny for a few weeks, probably a couple of months, but you'll feel okay straight from having the op. Really, the next day you should feel okay. Might be a bit sore, might be a bit bruised, and might be a bit battered and bruised and stuff. So but yeah, it's not that kind of invasive really. An inverted nipple correction, hopefully you'll be able to get back to things relatively quickly. Do you offer a donut breast lift? Oh dear, we're not doing well. We're talking about things I don't do, so I don't. I guess it's a bit like the thigh lift. Thinking about it, so a donut breast lift is a breast lift where all you have is a scar around the areola. So you make a cut around the areola, and then you take a wider piece of skin. So you take a donut of skin, and then you cinch it in, and you can tighten the skin of the breast that way. It does create a puckered scar, but the puckers tend to settle. I do that sort of stuff for an areola reduction, but I wouldn't use it as a breast lift itself because I don't find it gives a very good lift, and it kind of flattens the breast. It kind of goes like that, as opposed to sort of making it into sort of like a pyramid sort of point pert sort of shape. So I think it's better to put at least a vertical scar, sometimes a horizontal scar, but at least a circumvertical or a lollipop scar, and sometimes a short T, sometimes a long T for a big lift. But I, as a minimum, really do the lollipop as a minimum. I don't, never say never, but hardly ever would do a breast lift with a donut. I don't find it gives good lift. I don't find it gives good shape in my hands. There are people out there who do it, so it must work. But I haven't found that a way to make it work in my when I do it. So if you want a donut breast lift or a thigh lift, probably not your guy. You want a circumvertical, or you want like a longitudinal scar thigh lift, then we can talk. But yes, those are what I don't do. I do other stuff though. There is stuff that I do. Carol B from the P. Carol, how you doing? You all right? Still at City? Still living the dream? How are you? Nice to see you. Haven't forgotten me. It's good. Right, I see Carol here. Just going to ask this other question. It's all right. Can we remove a pyogenic granuloma? Yeah, we can. So pyogenic granuloma is usually, it's often some kind of trauma or something like that, and you get quite a florid lesion from it. They can kind of look like skin cancers, and sometimes people why they're skin cancers, and sometimes there can be a skin cancer at the base. So it's one of those ones where you kind of think, well, it's probably a pyogenic granuloma, which is a benign thing, which usually sorts itself out. But as I say, they can be quite florid and they can be quite kind of obvious. So people often will want them to be removed, and we can remove them, and we will send them off for histology to make sure that it isn't a skin cancer, because I say sometimes there's a little skin cancer at the base. But the bottom line, in simple answer to the question, just keeping it on track, is yes, we can remove a pyogenic granuloma for sure. We can. I mean, we can talk to you about whether we should remove it and what you should do, but can we? Yes, we can. I would say we can remove anything, but that's not true, because people keep on saying stuff like on an eyelid, I keep on saying no, and on the bottom, and I say no, and on the, so anyway, but yeah, we can remove a pyogenic granuloma. Can I ask that if you remove a mole, will it get tested for melanoma? Yes, it will. I mean, that's the main reason for the test, really. I mean, it's very rare, melanoma, for a mole to come back as a melanoma, but we will pretty much always remove, or rather send a mole for histology. Sometimes there's something that you can tell is not. I should put my arm up. Is not, it's a skin tag or something like that. We might not send, but most sort of pigmented lesions, most brown moles, we will send, and the reason for sending it is to say whether it's melanoma or not. Basically, that's basically what you want to know. Sometimes you get different names for them: junctional nevus, compound nevus, intradermal nevus. There might be funny names for it, but bottom line is it cancerous or is it not cancerous? Because if it's not cancerous, then it's carry on, and if it is, you might need other stuff done. So yeah, if you come to us and have your mole removed, it will get tested for melanoma. Faux show it will. So we got 1917. So that's good. I've got flash gold. That's good, isn't it? Flash gold. Well, full disclosure, I'm out. Okay, I'm out of questions. I've got a flash goal. 3 gifters sent rows to your live in 15 minutes. Achieve this to win a 24-hour live. So I got a flash goal. Your current live goal will resume when the flash goal ends. Achieve this goal when 3 gifters send rows to your live. Pin it to get more attention. I don't know what this is, to be honest. What sent rows to your live? What does that mean? Okay. I probably shouldn't have done that as I'm about to finish. Anyone going to send rows to my live? So, yeah, I'm done. More ways than one. But the most obvious way is in having all my questions asked. So I now got to wait for 3 people to give rows, but no one's given any rows. So what does that mean, giving rows? Is that like giving a thumbs up? Are you this? What? Are you into cars? Is that a question? Am I into cars? I've got a car. I think they're a bit of a, bit of a waste of money, aren't they? Not a very good investment, cars, are they? But yeah, I do like cars to a degree. Sorry, it's all in white. That's I put my. Does it look weird putting my arm up? Probably does. Anyway, apart from am I into cars, if there's any other questions. Ferrari kind of man. Yeah. Okay. I used to have a Ferrari, but I sold it, and yeah, I did like it. It was good. Anyway, that's life, isn't it? Life moves on. Okay, so any other plastic surgery type stuff? I will be anyway. Guys, I have got things to do. Obviously, I'm a busy man. Obviously, I've got a question, I'll answer it. But if not, yeah. So, place to be, things to do. Invite to join the live. What? I have. Oh, here we go. We've got a question. I am coming for a consultation soon. I have diastasis recti. Right. Have you just got diastasis recti then, or do you require a tummy tuck as well? Because diastasis recti is extremely, well, I would say extremely, but it's easy to fix when you're doing a tummy tuck, but it's hard to fix if you're not doing a tummy tuck. So if you need a tummy tuck, repairing your diastasis recti is kind of like an integral part of the tummy tuck. It's kind of like a standard part, because as the abdominal skin gets stretched, meaning that you need a tummy tuck, as do the muscles get stretched. And so and that's what diastasis recti is, that the 2 recti muscles are stretched apart, so there's a gap between them instead of them sitting together. So we call it repairing the muscles. We're not really repairing the muscles, we're just bringing them closer together. So repairing of that diastasis or divarification of the recti, which is basically a fancy term to say the recti muscles have got a gap between the 2, is an integral part of the tummy tuck, and it's quite easy to do a tummy tuck because you have access all the way to the rib cage when you're doing a tummy tuck. You have access on all of the whole abdomen, and you can repair the recti when you're doing it. If you don't require a tummy tuck, it's very hard. Well, as a plastic surgeon, we'd always try and hide the scar. So we would try and hide the scar in your lower abdomen, where you can hide it in underwear, but it's very hard to get to your upper abdomen if you're not doing a tummy tuck. As I say, if you're doing a tummy tuck, you get access to it straight off the bat. But if you're not doing a tummy tuck, it's extremely hard. And what the general surgeons would do, because they often repair diastasis, these sorts of things, or hernias in that sort of area, they would just make an incision right over it, upper midline incision, which is going to give you good access to it. So that's probably the best way to repair a diastasis in terms of getting access to it. But it gives you an obvious scar in the upper midline of your abdomen, which might not be ideal because of, it is not ideal because it's a big scar here, above your belly button. Sorry, I just can't read the thing, so I'm going to put that there. Iodized, yes, most likely tummy tuck. Is lipo needed as well for a smaller tummy? Yeah, so lipo is good. Lipo is good for the hips, the sides. I think when you do a tummy tuck, the tummy tuck gets rid of the excess centrally, but it doesn't really do anything to the sides, the hips, the flanks, the side bits. So lipo can be done at the same time as a tummy tuck to contour the side bits, and not everyone needs it. Weight loss can often help with the side bits. So yeah, we normally assess you to see whether you need to have liposuction. Most people could have some liposuction, to be honest with you. There's something there on the side bits in most people, but it does make it more expensive, and so sometimes people do weight loss and other things. But if you don't have liposuction, I always say to people that you've got to acknowledge that those side bits will still be there. The hips, the flanks, this bit of fat will still be there. You can't really do anything to contour that when you're doing a tummy tuck if you do liposuction. So you need to do liposuction to get down to the side bits, but it's not essential. But you have to. Sometimes when you have a tummy tuck without liposuction, you might feel, crumbs, what's that on the side? What's all this? And I always thought, well, that was there already. So I try and, not in a bad way, but kind of point it out pre-op to say, look, there is a bit of fullness on the hips and the flanks, as there always is. We all have got some of that, and I can't really get rid of that when I do a tummy tuck unless I combine it with liposuction, which is perfectly reasonable to combine it with liposuction. It's a perfectly standard thing to do, but it does increase the cost. Yeah, so it's quite common to have it with liposuction. Thank you. Liking life. Thank you. That was a good one. Thanks for asking that at the last minute. E squared. Looking forward to seeing E squared in the clinic. Right then. I've got any roses. What on this earth is a rose? Do you mind doing this? Me too. Yeah, good. Okay, E squared. Looking forward to see you soon. But for now, E squared, I'm going to check out quite literally checking out. So I will look forward to seeing you next week, same time, same place.